One of the biggest obstacles for people with chronic illness is the perception that one has to look sick to be sick. I have often wondered, what does it look like to be sick? Does a person have to have a runny nose, coughing, achoo, sneezing, have a raspy voice to be considered sick? But then what about cancer patients? They may have a fatal diagnosis but appear to be perfectly healthy. Some may lose their hair, but there are also other cancer therapies in which hair loss is not a side effect. Are they not sick because they do not appear to be gravely ill? And then there's chronic illness. These are long, drawn-out conditions in which a person's health waxes and wanes. On a good day, a person may be able to leave his home, go to the grocery store and the post office. But on a bad day, the person may not be able to leave his bed at all. If a community member sees a person with chronic illness out and about, they often assume this must be the person's normal, everyday health. They have no idea that this one good day of health is the first time the person with chronic illness has felt well enough to leave his home in over a month. But this information is often not conveyed to the rest of the world. Society has no idea what it is like to have health which can dramatically change in a moment. They believe because you are well enough to do something on a good day of health, you have the same health and the same energy levels to complete the same tasks every single day of the week. Family and friends often have a hard time understanding what it is like to have a chronic illness. If you try to adapt your life to meet your medical needs, it can often be met with ridicule. Are your legs weak and you need to use a wheelchair? You may be told, you're just being lazy and you want attention. Are you struggling to breathe? You may be told, you're just out of shape. You need to do some exercise. Are you exhausted and need to lie down? You may be told, go to bed earlier, get more sleep. When I first became significantly ill in 2008 and 2009, it was hard to tell family and friends the constant struggle it was to continue pushing forward through normal daily activities. I was young. I was healthy. I did not appear to be sick. If I tried to explain to someone I could not attend an event or needed special accommodation, the information was met with scorn. In 2009, my niece and nephew were baptized. I was told to be at the church at 9 a.m. for the ceremony. What family members failed to inform me of is they wanted to meet at 9 a.m. at the church so we could all go and sit together for the 9:30 a.m. service. The church service was 1 hour and 30 minutes long. After the church service, there would be a break to allow the congregation to leave. Then, the baptism ceremony was to follow. The baptism actually began at 11:30. Mornings are very hard on me. My heart rate is very fast. I cannot stand because my heart will race out of control and cause me to pass out. When waiting to enter the church, there was no place to sit down. I stood for a while and then finally I sat on the ground. When we entered the church, I was feeling very unwell. And then the church service started. It was a lot of standing up, sitting down, standing up, sitting down, over and over again. My body could not tolerate the constant up and down motion. I fled from the church and went back to the lobby where I found a lovely piece of ground and promptly passed out. My father followed closely behind me to make sure I was okay. The church greeters wanted to call an ambulance. My father assured them I just needed to lie down for a little while. When the priest heard the commotion, he came out of his office. He saw me in a heap on the ground. He then went on a very long sermon about how I was a disgrace to my family. Here I was at church on Sunday morning, hungover because I had to go out on Saturday night and get drunk. The priest went on and on and on about what a horrible person I was and what a shameful and disgraceful person I was before the eyes of God. When the baptism started, I crawled on my hands and feet into the church. I found an empty pew and lay down for the ceremony. I was completely humiliated by the whole ordeal. If only my family would have been honest and told me the actual start time of the baptism, I could have easily come for the short 15-minute service, which was late in the morning. But most people have no idea what it is like to have a chronic illness, which makes even going to church a challenge. When trying to get medical care, having a chronic illness can be a huge obstacle. Some doctors will have no idea what your medical condition is. This can lead to your symptoms being undertreated, overtreated, or ignored. Others will say you do not have your medical condition and are only faking your symptoms. You will then be given a one-way ticket to the psychiatric ward. Others will be freaked out by the extent of your long medical chart and will drop you as a patient, stating you're too complicated of a case for them. One of the most common issues with having chronic medical conditions is your symptoms are not taken seriously. If you have chest pain, your chest pain is not serious because you're at low risk for heart issues. If you're having severe GI pain, you'll be told it is stress or anxiety. Your GI tract is just fine. In late 2009, I was having severe GI pain. I pushed through it for 6 weeks. Then the pain was too much. I could not eat anything without becoming severely ill. In February 2010, I went to my primary care physician. He sent me immediately to the emergency department. I was hospitalized. I told the medical staff, I believe it was my gallbladder causing all my issues. I was told no, it couldn't be my gallbladder because I was young and thin. I was not at risk for having gallbladder issues. Days continued to pass. I remained in the hospital. I only ate liquids. On Friday, it was decided my gallbladder would be taken out on the following Monday. On Saturday morning, a woman came to the emergency department with severe GI pain. It was determined she needed her gallbladder taken out. The surgeon was called in. He decided since he was scrubbing in for one surgery, he would also take out my gallbladder. After I woke up from the anesthesia, the surgeon came into my room. He seemed very bashful and apologetic. He told me they removed my gallbladder. It was inflamed, infected, and about ready to rupture. My gallbladder was 3 times the normal, regular size of a gallbladder. If the surgeon would have waited until Monday, I probably would not have survived. The surgeon apologized for not taking my concerns seriously. The surgeon said my surgery was the one which was the true emergency. If you ever have tests performed, keep a copy of the results. When your doctor reviews the test results, he or she may brush off the abnormal test results as a fluke, an unexplained abnormality, or they may even suggest you fake the results. Whatever the case may be, keep a copy of the results. If you decide to seek care elsewhere, bring along the test results with you. Different doctors will interpret the data differently. In 2016, I had testing done on my heart. The primary care physician told me the results were normal. I then followed up with a very experienced cardiologist. He said my test results would be normal if I was an 85-year-old woman, but for a person as young as me, my test results were about 20 to 25% below normal. He said, using this criteria, my heart was not functioning properly. Recently, when I was having more heart issues, I had more heart testing done. My primary care physician was very concerned, and he told me my results showed I had right-sided heart failure. I then went to see a cardiologist. The cardiologist also agreed my test results were abnormal, but he said since I'm thin, then people can have abnormal test results. He also said since I'm young, I'm at low risk for heart issues. Despite having an extremely fast heart rate, high blood pressure, chest pain, gasping for breath, and having abnormal test results, my heart was not the problem. A few hours later, I was rushed via ambulance to the emergency department. A large blood clot was in my lungs. It was causing my heart to fail. I suppose the cardiologist was right. My heart was not the problem. It was a blood clot in my lungs, which was causing my heart to fail. When you have a chronic illness, one thing you need to remember is there's no way for the rest of the world to know what medical conditions you have or what symptoms you might experience. Even if 2 people have the same illness, symptoms vary from person to person and from day to day. It may be helpful to sit down with family and friends and explain your health. This may or may not be well received. From my own personal experience, no matter how much I've tried to explain to others what my health is, most people do not understand. Many people will often not believe your symptoms are as bad as what you say they are, or that you really do not have all the health issues. Don't get angry. More often than not, the person is in denial. They do not want to believe you are sick. They do not want to believe there's anything wrong with you. I've had this happen in my own family. Family members have suggested I make up my health issues. I was even offered psychiatric help. It It was only after I developed respiratory failure and was started on a ventilator to breathe that some of my family members finally understand that my health conditions were real. If you live with family, it may be helpful to develop a system for understanding your health. A friend of mine has note cards in which she states various conditions of well-being. She writes on them, feeling exhausted, muscles hurt, low on energy, feeling great, have a headache, etc. She will then post these note cards, which explain her symptoms, on the bathroom mirror. Her family can look at the bathroom mirror and understand how she's feeling for that day. If she is tired, they know to leave her alone and let her rest. If she has a headache, they will ask if she needs any pain medicine. This system is simple and allows for her whole family to know exactly how she is feeling without causing a lot of drama. The one thing to remember is be patient. It is not easy for most people to understand what it is like to have less than ideal health. Be grateful for people who help you out and be kind to everyone, even if they do not take your medical condition seriously. Stay calm and let the words of the world roll over you as the sea rolls over the sand. Whether it is family, friends, or the medical community, remember, understanding comes through patience. Thank you so much for joining me this week. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.